then you think like this. Who to talk to, what to say, and how are you going to say it? That's our Bible. I mean, traditionally the drug companies didn't advertise to the consumer, it was just to the doctors. The doctors were the gatekeepers. Advertising to the consumer is a relatively new idea, only since 1997, and it is working. You have to be more creative, though. With all other ad campaigns, we talk directly to the consumer, but with these, we say, talk to your doctor. You know, for our protection and for their protection. I mean, we can't very well say buy drugs, even though that's what we do. Did you know that the FDA regulates what we do? We're in a situation of fair balance. Fair balance meaning that we have to say what the side effects may be. So for every 60 seconds of airtime, we have 25 seconds of fair balance. It's a little tricky though, because we also can't advertise the company. We advertise the drug, not the company. But when you spend $120 million a year on advertising, there's a way to make it work. Do you understand that? Fair balance? I mean, I know the same amount of second time for the sales pitch isn't the same amount of second time as the side effect. But the consumer isn't counting second time. I mean, the restrictions on all of us here with the guidelines can make us all look nuts. But it's a lucrative shade of gray.
Courtney was the first Jewish bisexual I'd ever met, and she knew. She just knew who she was. I make no apologies for who I am as a woman or as an artist. Courtney used to say that every 15 minutes. I liked that, because being Catholic, I was making apologies for my mere existence. I'm like a living Virginia Woolf. That's an artist, Jenny. That's who I'm going to be when I grow up. My dad, he tried to take the brownness out of my skin, but he could not. Y mi madre trató de convencer que yo solamente soy mexicana. Pero no es. I had already been exposed to white culture. I began to rebel. When I would go to my dad's, I would wear a tight t-shirt that said they were chica on it, and speak to him in Spanish that he did not understand. Y entonces, I would go back to my mom's, where I would find old Barbie dresses and put them on the statues of her Virgin Mary. Last year, for example, I got a call from Fortune healthcare provider that said that if I didn't give them, one of my patients, a certain drug for her anxiety, that her coverage would be discontinued. Well, it was then I had to completely rethink my practice. And the way it is set up, really, is that you can now be with a woman from menstruation to menopause. And I started to think of antidepressants, well, as part of her tool chest, for her needs. I mean, it really is all about treating disorders. There are so many disorders we didn't know about until about 3 years ago, like PMDD. Take a look at this.
Think about the week before your period. Do you feel irritability, tension, tiredness? Think it's PMS? Think again. It could be PMDD, premenstrual dysphoric disorder. You know, those intense mood and physical symptoms the week before your period. Sound familiar? Call to get free information about PMDD and a treatment your doctor has to relieve its symptoms. Want to put up with this another month? It's back. The week before your period. Mood swings, bloating, irritability. Think it's PMS?
Did you take my keys?
Maybe it's PMDD. Those intense mood and physical symptoms right before your period. Sound familiar? To find out how your doctor can help, call or visit pmdd.com today. Why feel like this another month?
Okay, stop the tape. I just would like to say to all the women in the audience, yeah, we might get a little cranky during our periods, but so what?
They've been trying to make that a disorder for years. Will everybody please just get off of my uterus?
Parents like mothers are a great market for two reasons. Well, no, actually for more than two reasons, for quite a few reasons. You have to understand the psychological impact of parenting. And once you can do that, you can play that up in the ad. Every parent wants their child to do well in school, fit in, be well liked. Welcome to ordinary.
2003 was a big year for the Prozac puppeteers. They finally got their G rating from the FDA. Yippee! So come on, put your hands together, because now there's Prozac for kids.
I used to have trouble with Johnny. He would cry and scream that we had to move 7 times in 4 years. But now all I do is give him his medicine, just like the doctor ordered.
I used to have trouble with Sally. She was so shy and introverted, but now all I do is give her medicine, just like